கல்வி, விளையாட்டு, ஆன்மீகம், மருத்துவம் மற்றும் அனைத்தும் ஒரே சேனலில் ST நியூஸ்.
Applied and the graph is coming up, there was a small tear and the graph was very clear. So basically, focus on small areas and get them clear. Whether everybody knows Tirukural or not, everybody knows Noy Nadi, Noy Mudal Nadi, and Taripu, Vai Nadi, Vai Pache. If you come to the root cause of a problem, then you can cure it. Very often in abdominal disease, you have somebody with vague abdominal pain and you suspect that there is some growth or something. You do an MRI or a CT, you pick up the fact that there is a small hidden cancer or some small hidden stone. So compared to the when Sir went to medical college or when I went to medical college or when I went to medical college, these days it's very investigation based. People are coming to you with a CT or an MRI and saying, this is the tumor, you operate, or this is the stone, you remove. It's become that way. Those days to us, is the pain starting here? Is it going to your next door and then coming back? You know, those days are completely gone. Now we're very, very investigation based. My humble request to every one of you is, in this place, this ground plus 4 floors, we've stacked it up as a pure investigation center. Even in this floor, if you look at those 4 rooms there, they've got echo, treadmill, ultrasound, etc. It's got sleep study, nerve conduction velocity, EEG, sleep EEG. You know, only my wife knew what I was doing in my sleep. No, the whole world can do. No, you do a sleep study. So things are now becoming very focused. The other great advantage is MRI. We have Dr. Zishan here with us and Dr. Deepa, senior radiologist. It does a very good perfusion study of the heart so that we can find out whether the patient has a significant risk of a heart attack during a surgery. So indeed, now we I discussed when we do any major surgery, the biggest worry is, you must have all read about this recent bariatric surgical death. That boy had a table. I spoke very strongly defending the doctor day before yesterday, and I think it's coming out today. Very generation channels. I spoke to the doctor concerned. He started and he had something like a heart attack and he has died. So at that point of time, people ask, you should have checked this, you should have checked that. Suddenly, people who are shy of investigations before surgery, when there's a complication, the first thing they ask is, did you do this and see? So things have now changed. Dr. Prabhakar is here, very, very senior surgeon. He also knows that there are inherent risks in every major surgery. And to de-risk it, we've got this new MRI now. With this MRI, Prabhakar, we can actually predict, have an idea about the patient's perfusion, heart, and the likelihood of possible heart attack during the perioperative period. Then go into detail of this. So this, I want to end up with a small joke. It's a true thing, which Professor C.M. Carr told me many, many years ago when I went to Baltimore. The best medical school in the world is supposed to be John Hopkins. When you go to John Hopkins, the reception, you turn right of reception. It's a very interesting story, but it's true. You have the optometrist. And next to the optometrist, there'll be a big plaque. And it'll be printed there, the story of Mr. Braithwaite. So Mr. Braithwaite, this happened some 40, 50 years ago. He went there to have the screw in his glasses. You know, like you have a glass, you need them fixed. He went the screw in his glasses to be fixed. He went to the optometrist. The optometrist, I'm saying, though we're sitting in the middle of an investigation center, we should not overdo it also. So that man said it's true, screws little loose, but you just check your eye anyway. The next also, the optometrist, he checked the eye and said, there's something wrong, I'll call the ophthalmologist. So the ophthalmologist saw, and when he looked inside, he looked a little pale. He sent him to a general physician. It really happened in the 50s or 60s. General physician saw and said, you have anemia. In America, if you have anemia, first thing they do is a colonoscopy. Because everybody has colonic cancer, very high incidence of colonic cancer. They did a colonoscope, and the colonoscope perforated his colon. He became very sick. He went for an emergency surgery, and they pulled out his colon and kept it in a bag. He was passing motion on the outside. Then they kept him for another few weeks like that. Then they operated again, put it all back inside. So this, and of the 700 hospitals, only 3 of us have gotten it. One is, I think, where are the United Words? In Apollo Proton Cancer, MG Manasa. 3 of us have MG Manasa. So the 3 of us have gotten it. See, the idea is that there's so many coils in such complex technology that you can get everything from, you want a knee joint, you want only a thumb done, you want only a finger done. You can. Dr. Yogesh,